Right. Good morning and good afternoon and also good evening to all of the participants, the distinguished panel. First of all, I would thank Mr. Salim for allowing me to be in part of this conference. And I hope that from these sessions, it's going to be like a new networking establishment between all the experts in the field. So the topic today is about the stress management. And as we all know that with this pandemic era of COVID, there's lots of, events that make a lot of changes, especially emotionally situations whereby all, whether you are a worker or you are at home or anywhere, you'll be much affected by stress, especially the COVID, something new. And now onwards, probably this be more very, challenging problem that I think, and it's very important if we discuss it, we discover it, explore it, therefore we can make early interventions to avoid it from become, something that very dangerous. Because why? WHO predicts this millennium, the most risk mobility is associated with suicide and also the mental problem. So today I would just would like to share with you a very important approach for us to to aware, and therefore we can make early intervention if we face any problem with stress. Okay, so which part of the photos belong to us? And I think in this time, probably for us, the first one, but for the rest, we can have a different, manifestations of, a stress level. So we hope that if you know how to tackle it, we can make like the first photo, everybody smile. Even though we have problems, we still can smile. Why? If you not, learn to improve our, emotions later on, if we come to something that it might affect your life. So it's very distressing. Okay, so stress. Stress is any change that creates physical, emotional, or psychological discomfort. So individual may respond to stress differently. It depends on what will be the threshold of stress that you can cope, and how you counteract with the stress, how you get adopt with the stress, and how you overcome it. So it's different from one to another individual. So if you know how to identify it, how to respond it, probably it will be good, especially in this era. Everyone is very, very fear of being infected by COVID. And then, why? Because why? Till now, we don't have the actual treatment yet for this problem. So that's why we are so worried. Even now, there's a lot of limitations and social distancing or whatever. It's not something that new. So although stress is a fundamental to survival, it's also strongly related to several brain disorders, including depression, anxiety, and also the post-traumatic stress disorder. These are the common problems that we encounter or we face during the previous year. And furthermore, now it become a very stressful years since the past 2 years. So, however, the stress actually is something that good actually if we take it positively. Why? So the positive stress would encourage individual to adapt and improve the adaptive skill level, raise individual awareness against the problem, and also they become stronger in terms of survival if they can take it as positively. Why? To improve themselves. If this is such condition, you take it, then the stress will be good for you. However, if you take it in a negative way, it can affect the performance of individual, because it is beyond the individual ability to cope with that. So it affect individual body system, whereby the more, cortisol, stress hormone will be released in the body. It will affect the metabolism of the body. It will triggers the sympathetic, actions, whereby you will get the, it will associated with hypertension, the coronary artery disease, and also other stress condition that might affect your health. So these are the factors that might, people don't want to be, those who cannot cope with stress, they will end up with hypertension and also coronary artery disease. So it also will affect the behavior or creates a physical problem. You can weak, fatigue, malaise, you cannot, respond in a good way, especially, and also the performance. You feel sleepy, and then this is something that not good for you, especially in the workplace, whereby you're dealing with something like a machine in the factory. It might injure your, your fingers or anything, and you can fall down in the machines and can create a very bad, effect. So, factor of stress, it basically affected by the emotional, environmental, and also physiology. So, the emotions that everyone know, if you're stressed, you can feel, you can look at your face, or the wrinkles on the, the face, not a cheerful face, a very sad, very, like you have problem for the environment, you cannot cope with that. You cannot, you can't bear with the noise, the hot weather, or extreme cold weather. You cannot, your body cannot function very well. And in terms of physiology, also you have probably the eating, with the sleeping, your metabolisms and everything. So it's very bad effect actually. So demands exceed their personal or social resources, the user is able to mobilize. So this, if it's something to do with the emotions, and also make you difficult to adjust or modify with the adjustment of the behavioral. And also stress is not what happened to you, but how you react. Why? Because we cannot avoid stress sometimes. So we have to know what are the stresses, and also how to cope with that, and how to remove it from us. So there are three things. We must able to recognize it, we must able to cope with it, and also we must know how to, to overcome, to make stress like a very enjoyable moment. Whereby you can see that if you are stressed, your performance or your achievement is better. Without, because why? Sometimes stress is very, very important for us to make us more achievable in terms of KPI. Right. So what are the changes, or the event, or good or bad, that these are the things that might change your life. So there are a few things like you lose your spouse, there's separations, or you have family problem, you're being you lose your job, and you think about your financial income, you have broken a family, and problem at work, and also social factor like social distance, and also during the COVID, you can see that everybody stay at house with the crowded environment. There's no time for them to talk each other. Everybody is, like do their own work with the, with less communication because of the problem with the MCO. So these are the things that might affect the performance, and people tend to have more problem with the, the stress that they have. Okay. Because of the demands of today's work environment, pressure at work is unavoidable. We cannot avoid now. because of the situation, because of the COVID pandemic, everything. So now we cannot work. Last time we think that we can run away from the pressure, but now we have to face the pressure. But how we going to face the pressure? Because while some individual may be able to work and learn very well and motivated, making them accepted the pressure and adapted to it. Whereas majority cannot. Majority cannot. Some individual cannot handle the burden of workloads everywhere very well. So it causes the uncontrollable pressure and stress. Like frontliner, those are, those are working during this COVID MCO, the help, the nurses, the police officer, the firefighters, they are work in a stress condition. And 77% or more than 2/3 of them end up with this problem, with depressions. They cannot perform the work very well, and it lead to the, negligence, and those who are dealing with the dangerous items, they may not with the morbidity. So this is something that very dangerous, especially it affect all, not only to certain group of people, but all a group of people. For work organization, work design and management, unsatisfactory working condition, and lack of support from co-workers and supervisors can all contribute to work-related stress. So the teamwork is very important here, and understanding. We are not going to achieve anything if we cannot coordinate in terms of the few levels of working staff or level of department. So coordination is very important, communication is very important, understanding is very important. Because why? It would be better we solve the problem even though it's a bit delayed, rather than we're not able to complete the mission or the work very well. We need that there's no production in the end. If we cannot do it, it's better a late but safe and come up with something very good rather than we cannot get anything in the end. So another problem is that the expectation and pressure that are not matched to worker knowledge and skill. This is actually, we partly resolve this problem. This is probably the old time before the COVID era, but with the skills development, with technology now, we partly improve in this part, except for if we have very effective or very efficient coordinations of the work, meaning that the leadership of the organization is very good, then probably we can handle it in a better way. Okay, different workers look at the different scope of job differently. So this is the key role of leader or manager of the organization, to make sure that everyone is understand what is the mission and visions, how they can work together. This is not individual performance, but it's a group performance. This is a very important key to solve the, partly solve the pressure that they have. And everyone should have give hands. Everyone should give hands based on their, whatever they know, what other experiences they have. They should give hand and help each other. This is not even, even though in the hospital organization, one doctor cannot work himself alone. It must be further supported by the nurses, the attendants, the specialists, the director, and everyone should give hands, and no such blaming attitude among the level of of worker or expertise. Meaning that we should complement each other. Everyone should complement each other to make it a successful mission. So this is something that we should change, especially in the bigger organization, structure. And everyone should have a similar aim, similar aim, a similar target, and they should, cooperate each other. They have to improve their communications and whatever. All right. So with that, we have to understand, before we enter it, we have to understand why this is important. the process of dealing with stressful situation involve complex mechanism. Integrations of the brain and body, even our body itself, also we cannot work alone. We have to work together with the brains as the the starting point. It will give effect to the other parts of the body. So it's very important. So as we all know, the identification of stressor leads to activations of two major. There's a sympathetic adrenomedulla axis that secrete noradrenaline and also norepinephrine. And another one is the hypothalamus pituitary adrenal that secretes glucocorticoid, which is the pathophysiology in the slower or long-lasting response. Whereas the prior one is with the pathophysiology of the rapid response or immediate response. So once these axes are activated in response to a given stressor, they will generate a coordinate response, and the hemostasis restorations will occur. So okay, this is basically the summary of the flow of the response and the mediator release in the body and how it affects the body and how it being regulated to get adapted with the stress that they have. So stress response promotes energy mobilization. So it's good, you look at this one, it's a positive point. The stress response promotes energy mobilizations, metabolic changes, activations of the immune system, suppressions of the digestive and reproductive system. But it's not good. It's not good because why? It can secrete more hydrochloric acid in the body, and those who cannot cope with the stress, they will have the gastritis, they will competitive ulcer disease. So they will come up with epigastric pain, abdomen pain or whatever, and sometimes they can take the medicines to cure the thing until they had developed complications such as the upper GI bleed and also lower GI bleed, and their performance at work also not in a good way because they are normally feel lethargy, sleepy, and so this is something not good for the worker. And this body-brain effect mediate alteration in physiology enable the attention and survival. If they can cope, we can adapt it. Slowly, it become a good mechanism for them to improve themselves, especially in terms of response and also skill, right? Okay, these are the physiology part of what happened for the stress. So it affect this is something to do with the oxidative stress also, and you can see that when the cortisol is released, it can block the inflammation. So what happens that it can suppress the immune cells. That's why during this COVID era, we must mentally, emotionally good to cope with that. We're not in a fearful conditions. We are well prepared. Say that if COVID come, we treat as like normal common flu. We take supplements, we use a lot. We go to hospital early, get early treatment, think positive. Inshallah, you get protected from the very bad side effect. But if you are stressed in the beginning, your health is not good, and then probably your immune cells also not functioning, not working very well, and that's it. When the disease come, it may deteriorate very, very serious and very, drastically. That's why we can see that many with the immunocompromised situation like diabetes mellitus, obesity, elderly, so they cannot tolerate this infection, whereas others can drink very well. Okay, for the chronic stress, the adrenal gland release high cortisol to inhibit inflammation. So this is something not very good actually. Something is very good. So we have to try to improve that. So here again, I put it in the diagram. what you get it when you have stress. So you got pain, non-specific pain. You got migraine, you get the neck pain, back pain, muscle pain, everything. The stomach upset because they increase the hydrochloric acid secretions. You emotionally, you cannot, it's not stable, forgetfulness, feel weak, malaise, less of focus, and also it also may associated with overreacting, overeating, obesity, and also easily angered. When it's stimulations, something that you cannot cope with that. Of course, it will affect the libido also, or you can perform because of this the lack of libido. Okay. So how preventions of stress? So actually, if you look at this all the answer for that. We must have the knowledge. We have to learn. We have to adopt with the, we have to choose the healthy lifestyle, healthy food, everything. Support from the family. You can talk to someone, listen to someone, share the problem, share your experience how to handle the problem. This may release partly, and certain people they cry. Only with crying can help you release 50% of the problem that you suffer by crying. And of course, those who have good religion practices, they can cope with that. Especially there are few approaches, a way how to cope with that in a relaxed manner. So probably we can share with you after this our hands experience how to cope with that. Okay, for us here, we choose to have a healthy food here. We got, here, if you come to Malaysia, known as, the heavens of food here. Welcome to Malaysia after this. If there's no more restriction, please all of you come to Malaysia. You can enjoy lots of, foods here. You can get Bangladeshi food here, Pakistani food here, Indian food here, Japanese food here, Americans, the Western food here, and of course the Southeast Asia foods also like satay, everything. So very, 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 very good place for you. Please come to Malaysia after this. Enjoy our foods here. Make you happy, make you relax. So we have plenty of, a variety of foods here that are probably suited to all, of course. And you must leave that which makes you doubt. Because why? And one how to say that. So whatever, if you're not sure what you eat, probably will look the uncertainty. You'll be more, confidence. But if you take something that very, where the sources of this very clean, halal, and you feel safe. You feel safe, you feel confident. And this is the starting point. If a good food, got halal food, so it make you enjoy anything, includes your both physical and also emotionally and also spirituality. This is a starting point. If you're good, the correct foods, you don't, then probably it will make your, contribute to very health of body or a good, functions of your body. And also here, you can see here, since my topic is more on the spirituality condition, if you can control this, of course, we try to avoid this one. But if you need that, probably you must take it. But we try to avoid it. If everything is controllable, you can control spiritual, because you know what? Spirituality can control your hormone level, your higher function level. So if you have good this one, and the rest will be easier. All right. Okay. So another one is that we found another interesting research from Japan, whereby they found that fasting is other methods of can improve your body function. Why? Because even certain cancer cell with the fasting can kill the cancer cells. This, if you have time, you're interested, please go through this a journal from Japan is won the Nobel Awards for this finding for fasting cure. This was autophagy concept, the healthy cell will eat the unhealthy cell. So this is good. So our health is very important as the key and the primary point of managing stress. And we must have a good food, good food for the good health. Okay. Okay, now we go to the how to manage, how to cope with the stress. So basically, I divided into 4: biology, psychology, spiritual, and sociology. And these are the things that we have in our setting right now. Everyone will have these 4 principles. Everyone will face this, will have this, and they have to treat based on this. Whereby the biology one will involve the healthy diet, healthy, I'll take the medication for those are disease, got disease, and also therapy. So it's just the biology. I give example, if you're hypertensive, you want to work in a factory, of course, it's not suit for you. So you must treat the problem of hypertension. So by taking medicine, and also must have a good diet for you to make sure that everything is controlled. Therefore, you can focus in working in that kind of environment. And psychology, you must have a good, strong support for the, must have a counselor. Who is the counselor? Even your spouse can be a good counselor if they have the ability of listening. So counselor is very simple. You just have to have someone to listen to. Or if there's nobody there, you just go to the mirror and you talk yourself. This will be a good counselor for you. But you must tell someone. You cannot keep in your heart. Right? This is very important. Because why? If the stress in your heart, you don't tell anybody and it becomes worse. It can get worsening. So you must go there. Certain people, they cry. But certain people, they talk. So who? The question is who you want to talk to. If your counselor is good. If you're counselor, you just go to the restroom, you get your mirror there, and you talk yourself, right? Or you selfie, you put on a video, you just tell what in your heart. Therefore, it get released. So probably 70% of the problem can release with that. It's very simple. So everyone should have their a counselor, whether a self-counseling or with your spouse or your other family or with your professional counselor. And the third one, the spiritual part. This is very important because why? My focus is a psycho-spiritual. Number one, you must know when you need to be treated. When you feel that you cannot focus on your job or your work, you cannot control your emotion, and it's time for you to get the thing released. Who? Your counselor or yourself. So this is number one. Number two, the spirituality part. You must have the, the practices, what you do normally to make sure that your emotion is stable. So in our region, probably in other regions too, but I'll talk in my place. Basically, we have what called the heart purifications, meaning that we have to have faith, repentance, the hope of God's pleasure. You must be patient, and you must keep it sustainable. You must repeat it every time. So even we come up with a self-reflection tool apps, whereby you can make a self-monitoring of yourself, how you perform today. If you identify yourself, you have 100 stresses. In the end, before you go to sleep, how many percent release already? And everyone should release the stress before they go home. No, you shouldn't bring the stress to your home, to your house, to your family. Before you go home, before you drive your car, get the thing released. How? You cry, you make efforts, you do some things or whatever. When you release and go home. Therefore, the pressure that you have in the workplace, it will bring back to your house. At least 90% or 80%. Don't bring home. If you bring home, then your family will have the consequence of bad, effect of the stress. And of course, sociology. Sociologists will report why, because the family and community support, and you have your friends, you chat with them, you have drink with them, not drink alcohol, but drink something juices, tea, coffee, have a chatting with them in a healthy manner. It's something that you can share, improve yourself. We must have such a culture that we need the sharing of good and learning of a new things to improve ourselves. I think with this, a vicious cycle, you cover biology, psychology, spirituality, and sociology. Sooner or later, everything will get out from your heart, your pressure, whatever. So you will take it as a good, a learning process whereby you have to improve yourself for a better survival. Okay, medication for stress. Currently, there is no specific medication to treat stress because, if you look at the stressor, you get the causative factor. Basically, it's a manageable. You not even require medicine, actually, the chemical medicine, actually, to treat the stress, actually, if you know what are the stressor that you have, what you're going to have. So you don't have to take medicine, actually. The antidepressant most widely prescribed for anxiety, such as SSRI, such as Prozac, Zoloft, Paxil. Actually, if we look at the literature, it will associate with side effects of the drugs. Even a poor performance, sooner or later, you take too much medicine. So I think it's not a good one. Even though I'm a medical doctor, I would suggest that everyone should know how to cope with the stress using the psycho-spiritual methods. This will be the best, the safe, and less expensive. It's not expensive at all. You don't have to pay, actually, if you have a good, if you know the how to cope with that. But the best one will be this counselor who understand it very, very well, the concept. If not, then probably the one that I do just now, you must have a friend who want to listen to your problem. Is good. So it's your spouse, your wife, or your family. This is a very good one. Okay, because why this drug, we don't have the clear mechanism of action and the causative factor. So actually, when using the drug, of course, it will affect the the hormonal changes there, and probably few receptors be blocked. Because why? We believe that certain hormone can induce or can reduce the motivation. So that's why drugs not good. It can suppress, right? Okay, so the best one is the psycho-spiritual therapy. Meditation. For Muslim, they use a zikir, repetitive, like mentioning about the names of God repeatedly. You make your heart feel relaxed, comfort. And for certain people also, with prayer, they forget every problem. Any problem they have, they will forget it. And we treated it after they make a prayer, they cry, and get released. So I think it's something very cheap. Everyone should be able to practice it with comply to what religion your religion teach you. Because why? Lately we can see that people away from their religion, they are not practice religion, they are no longer practice religion. That's why their way of life a bit miserable, way. Okay. So meditation, what is that meditation? The practice of focusing your mind in silence, especially for religious reasons, and in order to make your mind calm. A wide range of movement in the variety of practices along with its specific purpose. So spiritual meditation can be defined as any particular movement or practices that have a sacred connection and meaning with self and universe or others. Please go through this journal. You can look at this one. So I think it's very helpful. It's very helpful. Spiritual meditation shows strong evidence in reducing the anxiety, stress, and depression recovery symptoms. Even one study done in Indonesia, they make a comparison, those who are practices meditation regularly and those who are not. They found that those who are practice meditation regularly associated with increase the antibody level, and they unlikely to have a flu, ill, sick or whatever, and their performance of academic performance are much better. Those are practices meditation regularly. So the key word is that you must have a way of performing your meditation regularly at a scheduled time. You cannot do once a month. Cannot. You probably can do half an hour a day regularly for you to release all the stressor before it coming to a stage that you cannot cope with that. So you can release, and you'll be happy. Because why? The stressor is always with you. You cannot run away from the stress. Okay. After that, there are several technique mechanism that demonstrate on the how. First of all, the simple way is a breathing technique, ventilation technique. You're stressed, you just ask a deep breath in, hold for a while for a few seconds, and you release it. You release your pressure. You take a deep breath in, assuming that is all the pressure in your side, in your body, and you try to cope with that. We hold for a few minutes, and you just imagine you release all such pressure from your soul, from your body. You release it slowly, slowly. Not to rush, but slowly within few seconds. You take, you hold, and you release it. You do it frequently, probably 10 or 20 times every 3 to 4 hours. You can do it on your chair while doing your work and get it released. And also with mindfulness and contemplate mind. With your mind, you control, you just imagine, and then get it cleared with the ventilation. Okay, so it can be something like a mantra, meditation, zikir, and doa. You make a prayer also. So it depends which one that you comfort with your choices. So you just do that. And also, I speak movement, meditation movement also. Movement, the hand, the head, the body, is you feel that, you do something. And I think, believe me, you get something and you feel something good for you. Even yoga also good. Yoga. I can see that at the airport, in Canada, there's a place for them for the yoga. You just bring your yoga mates there. You can do the yoga also at the airport. So by waiting for the flight or whatever, or while waiting for something you have nothing to do, you just sit down and just do a simple movement. So breathing is the most, I think, agreeable methods that easily done. Everyone can do this. Okay. After that, for us, we have few way of performing. Like we listen to the preach, which can influence your emotions. We can cry, make a wish, make a doa, and we just say the names of God. We recite, the Quran. And you can, those who are whoever your religion that you believe in, just practice it. It's good. It's good. If you're Muslim, you read Quran, you make dua, and you always say that Alhamdulillah, thanks to God, thanks to God for all the kindness, all the mercifulness or whatever that you have it. Okay, for Muslim, they perform salat. This is a movement actually. Is yoga adopt with this movement. In yoga also, and in Muslim they perform salat, for a few seconds. So you can do this movement actually, and you feel that, wow, even you have a back pain, you get released with this movement. So please try with it. Okay, so we Muslim, we practice 5 times a day salat. Certain people, they make yoga once a day. Before they go to sleep, they make yoga, or twice a day, early in the morning and after, before they go to sleep. Wake up and after. All right. Okay. And then actually a light exercise during the midnight, not the aggressive one. Because why? Aggressive movement might endanger your heart, but light movement, exercise, whatever, or you just make a self-reflection is good for you. So I think probably if there's a questions or whatever, probably I can respond it, even though yeah it's depend on the the chairperson whether question is allowed or not. But I think we are towards the end, because why? Allah does not burden a soul beyond that it can bear. So meaning that everyone here will face stress, we have problem, and believe me, the problem that you face, inshallah, you can bear with it, you can solve with it. Nothing much then, except for you must know how to tackle it, who would like to consult to, and when you must make a immediate action or response toward this problem. So with that, I think I end my sessions. I hope that if there is a question, probably we can respond, allow, or if not, probably any comments from the floor or whatever. Thank you very much.